Hello, I want to introduce you to two special team members we have at the Dental Advisor. We have Dr. Ona, who it's a pleasure to have her here. She works in Midland, Michigan as a dentist, and it's about an hour and 45 minutes away, and she's here with us today. And we've also got another key player of our team, Dr. Fiona Collins, who lives in Colorado, and she makes her way out here every about 5 weeks or so when she's not on the road lecturing. So it's a pleasure to have you both here. And I know that we've been seeing a lot more of you guys in our videos, and you've been helping out a lot in spreading the awareness of the research that we're doing here, as well as talking about your own personal experiences with different products and different techniques. So Dr. Ona, tell me a little bit. I know you've got a really unique history because you started out as a dental assistant.
Yeah, it's kind of funny to see my credentials and see that I'm a DMD and a CDA.
Yeah, it's very unique.
Yeah, that's because I started out as a dental assistant, and I absolutely loved dental assisting, and I just always wanted to know more. My passion was working with patients, so I ended up in a hospital setting, working for VA hospital, and I was inspired there by one of the dentists to actually become a dentist myself. So I went crazy, went back to dental school. And so now I am practicing in a community clinic setting. I have a never-ending passion for education and knowing everything about the products and how can this product, help the clinical setting, not only as the doctor, but also from the assistant point of view. Is this product going to be something easy to implement, something that's going to be easy for the assistants to remember all the steps and all that, as well as the doctor, is this going to give me a good, easy-to-use product and something that is going to give a great long-term restoration or product for the patient as well. So having been an assistant that long, I have a viewpoint that I can see from both sides.
Yeah, and many times in our editorial board meetings, this comes up where, we'll get a product and we think it's great and it works well, and then you find out on the, assistant side that maybe even just the packaging or the dispensing, and when it comes to infection control, there was certain LED lights we've liked in the past that worked really well, but they were just hard to clean. And those little things like that come up, which I think are very beneficial. I do thank you for putting the time in, and appreciate you coming out here for editorial board meetings too with that long drive.
Oh, it's a pleasure.
Yeah. And Dr. Fiona Collins, so you've got a special interest in infection control.
I do.
I know you're out extensively lecturing around the U.S. and you're in a lot of art, doing a lot of publications. So tell me what sparked, as a dentist, how do you get into the infection control arena? Did someone, did you have a really good mentor, or did you have a certain incident?
That's a really interesting question. So I practiced for many years, and I would have to say that initially I probably had no more interest than the average person in infection control. I did know that my mother had almost died of a hospital-acquired infection, so that sparked a little something in me. It happened while I was a young child, so I wasn't that aware of it at the time, but I certainly was later. And then while I was practicing, after a number of years, I actually came across a situation personally that it was a breach of infection control on any level, really.
Okay.
And it was a pretty egregious, and it was actually in this case a deliberate breach. The person knew that they shouldn't be doing this.
Okay.
And so that really got me, that and a couple of other incidents got me more and more interested.
Okay.
I then started looking at the CDC recommendations. I went to OSAP meetings, I went to other meetings, and I became more and more interested, specifically in infection control in the dental setting. I've worked in, I think one of the other things I bring is I've worked in several countries, and so it's interesting to see the differences, but really, especially at this point, there are much more commonalities than there are differences.
And I'm hoping you guys through education can help us when things change to stay on top of it, because it's second nature to you both, because you're following these, but it's I'll be the general practitioner who we're lucky we've got the connection with the dental advisor, but I'll be honest, if I was in a different practice, I don't know how I would stay so up to date on everything, so I think utilizing both these, like I said, key players, key doctors with your educational programs you'll be doing will be key in years to come to help us maintain staying on top of the infection control. So thank you guys both so much. Like I said, it's a joy to have you here. This is a little bit impromptu, but we figured we've got you both in here, and you're doing so much for the dental advisor. So we figured it would be wonderful to introduce you to everybody together. So thank you.
Thank you.